Common health issues in men over 60. PSA screening. The importance of prostate cancer detection. Hello, gentlemen, on the Vital Men 60 channel. I am Dr. James Edward Carter, a urologist currently practicing at the Mayo Clinic and a member of the American Urological Association, here to chat about the realities of aging with empathy and expertise. As men cross into their 60s, our bodies whisper, or sometimes shout, about changes we've earned through decades of life. But here's a burning question that sparked heated debates among doctors, researchers, and patients alike. Is PSA screening for prostate cancer a lifesaver that catches deadly tumors early, potentially saving thousands of lives? Or is it a flawed tool that traps men in a cycle of overdiagnosis, unnecessary biopsies, and treatments that do more harm than good? This controversy has divided experts for years. Some hail it as essential prevention, while others warn of false alarms leading to anxiety and overtreatment. Stick with me as we unpack this, backed by the latest 2025 science, to help you decide what's right for you. Remember, I'm not your doctor, so let's use this as a starting point for a chat with your healthcare pro. Overview of common health issues in men over 60. Before diving into prostate specifics, let's set the stage with the big picture. Turning 60 isn't the end. It's a new chapter, but one where health vigilance pays off. According to the American Cancer Society's 2025 estimates, men over 60 face a heightened risk for several conditions due to natural aging, lifestyle accumulation, and hormonal shifts. Globally, life expectancy for men is rising, but so are chronic issues. About 60% of men over 65 deal with at least 2 chronic conditions, per CDC data. Let's break down the most common ones, as they often interconnect with prostate health. First, cardiovascular disease tops the list. Heart attacks and strokes claim more men's lives post-60 than any other cause. The CDC reports that 1 in 3 men over 60 has hypertension, and cholesterol buildup accelerates, raising heart disease risk by 50% compared to younger men. In my opinion, this is where prevention shines. I've seen countless cases where simple steps like daily walks turn the tide. For example, a 62-year-old patient, I imagine, might ignore mild chest pain, thinking it's just age, but early checks could prevent a major event. Diabetes is another biggie. Type 2 diabetes affects 25 to 30% of men over 60, per 2025 NIH stats, often linked to weight gain and reduced activity. High blood sugar damages nerves and vessels, leading to complications like neuropathy or vision loss. Personally, I advise starting with blood sugar monitoring. It's empowering to catch prediabetes early, as diet tweaks can reverse it in 50% of cases based on ADA guidelines. Bone health declines too. Osteoporosis isn't just for women. About 1 in 5 men over 60 has low bone density, increasing fracture risk by 2 to 3 times, according to a 2025 PMC study. Testosterone drop plays a role here, as we'll discuss later. My tip: weight-bearing exercises like resistance training can boost bone strength by 10 to 15%, per research. Don't skip the gym. Respiratory issues, like COPD, affect 10 to 15% of older men, often from past smoking. Mental health matters too. Depression hits 15 to 20% of men over 60, linked to isolation or loss, per APA 2025 reports. And cognitive decline, including mild impairment, affects 20%, with Alzheimer's risk rising sharply. Sexual and reproductive health changes are common. Erectile dysfunction, ED, impacts 52% of men over 60, tied to vascular issues or low testosterone. Urinary problems from enlarged prostate BPH bother 50 to 60%, causing frequent nighttime trips, but prostate cancer stands out as a silent threat. It's the second leading cancer killer in men, with 313,780 new U.S. cases in 2025, per ACS. About 60% of diagnoses occur in men 65 plus, and 1 in 8 men will face it lifetime, This ties directly to our focus, PSA screening. Let's explore why it's so debated. Understanding prostate health in men over 60. The prostate is a walnut-sized gland below the bladder, producing fluid for semen. As men age, it often enlarges. BPH affects 70% by 70, causing urinary symptoms like weak stream or urgency. But cancer is the real concern. Prostate cancer grows slowly. Many men die with it, not from it. However, aggressive forms can spread to bones or lymph nodes. Risk factors amplify post-60. Age is key. Incidence jumps from 1 in 350 under 50 to 1 in 52 by 60 to 69. Family history doubles risk if a father or brother had it. African American men face 1.7 times higher incidence and 2.3 times mortality per 2025 SEER data. Obesity, smoking, and diet high in red meat add 20 to 30% risk, while exercise cuts it by 10 to 20%. Symptoms? Early stages are silent, hence screening's role. Advanced signs include blood in urine, bone pain, or ED. In 2025, 35,770 U.S. deaths are projected, but early detection boosts 5-year survival to 99% versus 34% for metastatic. My advice: don't wait for symptoms. Proactive checks save lives. What is PSA and how does the test work? PSA, prostate-specific antigen, is a protein from prostate cells. Blood levels rise with issues like cancer, infection, or enlargement. The test is simple. A blood draw results in days. Normal ranges vary by age. For 60+, under 4.0 nanograms per milliliter is typical, but 4.0 to 10.0 is borderline, and greater than 10 raises flags. Velocity, rise over time, matters. Greater than 0.35 nanograms per milliliter per year prompts checks. Free PSA percentage helps differentiate cancer, low free PSA, from BPH. But PSA isn't perfect. 15% of cancers have normal PSA, and 25% of elevated results are non-cancer. Factors like ejaculation or biking spike it temporarily. In my view, it's a starting tool, not definitive. Pair it with DRE or MRI for accuracy. The importance of PSA screening, benefits backed by science. Now, addressing the controversy, PSA's benefits. Early detection saves lives. The ERSPC trial, 2025 update, showed PSA screening reduces prostate cancer mortality by 20 to 30% over 13 years in men 55 to 69. For over 60, it prevents 1.3 deaths per 1,000 screened per USPSTF. A 2025 VHA study found continued screening post-70 correlates with lower 10-year mortality in healthy men. In high-risk groups, benefits soar. Black men see 30% mortality reduction. A 2025 Guardian report highlights PSA catching aggressive cancers early, avoiding metastasis in 3 per 1,000. Example, a 65-year-old with family history gets screened, catches localized cancer, treats with surgery, 98% cure rate. Personally, I believe for fit men over 60, screening's upside outweighs downsides if discussed. It empowers informed choices, potentially adding years. Risks and controversies of PSA screening. But critics aren't wrong. Harms exist. Overdiagnosis. 20 to 40% of detected cancers are indolent, never harmful. This leads to overtreatment. Biopsies cause infection 1%, bleeding, or pain in 5%. Treatments like radiation or surgery risk ED, 50%, incontinence, 10 to 20%. A 2025 NPR review of trials showed no all-cause mortality drop, and false positives stress 15% of men. USPSTF warns for over 70, harms exceed benefits due to slower cancers. A Bristol study found minimal death reduction but high overtreatment. My take. The debate stems from balancing lives saved versus unnecessary suffering. For frail men, skip it. For healthy ones, it's worth considering. Guidelines and when to screen. USPSTF 2025. For 55 to 69, individual decision. Over 70, against routine. AUA. Start 55 to 69 annually if risk factors. Earlier for high risk. ACS. Discuss from 50 or 45-40 for high risk. If elevated, follow with MRI. Reduces biopsies 28% or biopsy. Emerging. Spit tests more accurate for risk. Advice. If over 60 with symptoms or risk, get PSA. Monitor velocity. Example. A patient with rising PSA opts for active surveillance, avoiding treatment side effects, integrating prostate screening with overall health. Prostate issues linked to others. ED from cancer treatment overlaps diabetes. Low testosterone, common post-60, worsens bone loss, heart risk. Holistic approach. Screen PSA alongside cholesterol, blood sugar. My personal words. As Grok, I care about your whole self. If anxious about screening, talk it out. Knowledge reduces fear. Lifestyle. Mediterranean diet cuts prostate risk 10%. Exercise 20%. Quit smoking. Drops risk 30%. For BPH, alpha blockers ease symptoms in 60%. Kegels strengthen pelvic floor. Real-life examples and personal reflections. Consider Tom, 68. Routine PSA at 6.5 leads to biopsy. Early cancer treated with radiation. Now cancer-free, minimal side effects. Contrast with Bob, 72. Elevated PSA, but frail. Opts surveillance, avoids unnecessary surgery. In my experience, overdiagnosis is real, but manageable with shared decisions. I advise, weigh life expectancy. If less than 10 years, screening may not help. Empower yourself. Ask docs about PSA density, free PSA. Addressing broader health ties. Back to C. Common issues. Arthritis affects 50% over 60, limiting mobility. Tie to prostate by reducing exercise, worsening BPH. Vision. Hearing loss. 1 in 3 has cataracts, impacting quality life. Cancer overall. Prostate leads, but lung, smoking-related, kills more. 15% over 60. Colorectal. Screen with colonoscopy reduces death 60%. Mental health. Prostate diagnosis spikes depression 25%. Seek support. Conclusion. Empowering your health journey. We've tackled the PSA debate, a tool with 20% mortality reduction, but overdiagnosis risks. For men over 60, it's about informed choice, benefits for healthy, risks for others. Amid heart disease, diabetes, and more, prioritize checkups. My final advice: you're not defined by age. With knowledge, thrive. Chat with your doc, stay active, eat well. You've got this. Age 60 is not the end. Take action to keep your sexual vitality alive. If you find this video helpful, like, share, and subscribe to the Vital Men 60 channel to get more reproductive health advice. Thank you for watching.